Ellen Simmons with the Rural Radio Network. October is Breast Cancer Awareness Month, and the Nebraska Cancer Coalition is working to educate Nebraskans on the importance of breast cancer screening. Now, we're joined today by Erin Dorn, an internal medicine physician assistant with Beatrice Community Hospital. Thanks so much for joining us.
Thanks for having me, Ellen.
Well, breast cancer is the second most common cancer in Nebraska. So, knowing this key statistic or fact, as a healthcare provider, what are some of the main factors you believe women should be aware of that would put them at a higher risk for breast cancer?
Well, first and foremost, I think it's pretty obvious as we're talking about women here that being born female is your highest risk factor. Women have about 100 times more common risk of breast cancer than men do. Also, age increases your risk. So the majority of breast cancers we actually see in women 55 and older. About 5 to 10% of breast cancers right now are showing that there's hereditary or genetic mutations increasing their risk of that. And so we're seeing some of the breast cancers earlier. And then also just knowing what is your personal history, what is your family history. Those two things really do increase your risk, whether it's your personal or other first degree relatives.
All right. Well, for a woman sitting in your office, the list of breast cancer risk factors that can feel overwhelming. So, how do you help your patients understand their personal risk, and how can they use that knowledge to be proactive about their health?
Well, each time a female comes in for her annual exam with me, we make sure and we have them fill out a family history form. And if they're high risk for cancer in any way, we look at um, what is that family history or what is that personal history, because that's where we look into could it be more of a genetic link? We need to get some type of genetic or hereditary testing done with. Um, we update the family history every year because family history changes every year. And I think we forget that life goes on and, oh, maybe someone in the family did have a diagnosis or an abnormal testing that we need to be aware of. And then I also talk to them about it. There's no magic age that stops breast cancer. It's not like, oh, you turn 75, you may drop off some of our testing rules that we need to follow from a quality standpoint. But if you have a good quality of life and you're still active, you should still be talking to your doctor and getting your mammograms, because your risk goes up with age. It doesn't just stop. Um, and then breast cancer guidelines specifically, like first and foremost, start at the age of 40 for the average risk patient. If you're higher risk, your primary care provider should see that and know that and talk to you about the age of your family members that put you at higher risk, and that you may need to start testing sooner than 40.
Mm.
We
Okay.
also, I think it's important to know that more of the guidelines have gone to actually getting mammograms done every year instead of every 2 years. There's still guidelines out there that say 1 to 2 years, but I think it's important once you start screening, you continue screening and do routine screening, because that's how we're going to find it, is screening early and screening
Yeah.
often.
Yeah, I agree. All right. Well, breast density is a risk factor that many women may not be aware of until they get their mammogram results. Can you explain what breast density is and how it increases a woman's risk for breast cancer?
Right. So a lot of people think, oh, I have full breast or I have large breast. I must have dense breast, and that's not what dense breast tissue is defined at. You can't actually feel your breast density. It's something we only see on imaging with your mammogram. Um, and the background image of a mammogram is black, and abnormalities show up on there white. Or dense breast tissue shows up there white. So it's really hard for the radiologist to decipher, is this an abnormal lump in this area, or is their tissue so white and so dense it's going to be hard to tell anything on there. And the dense breast tissue is anything that's not fatty tissue in your breast, like your glands, or just fibrous tissue in there. And they've actually started rating these on mammogram results, where you have categories A through D, and categories C and D that are the highest breast density. They're the ones that have increased risk, and we're not sure exactly why yet. patients with higher breast density have an increased risk of breast cancer, not just an increased risk of us not being able to see it as well on a mammogram. But that type of tissue is a predisposing factor for increasing your risk. So getting your mammogram, seeing what your density is on there is important. And then talking to your primary care provider, because there may be additional testing that needs to be done other than a mammogram to be able to see better through your dense breast tissue.
Sure. All right. Well, thank you so much for joining us. A lot of great information, I think, for our listeners.
Yes, I hope everyone, I mean, October is a big month for breast cancer awareness, but you can get your mammogram anytime during the year. And I just encourage patients to get screened and make it a routine thing that you don't put off, because the sooner you can find something, hopefully the easier it is to start treatment and beat it if it is something that shows up on your scans. And make sure you're talking to a primary provider or your gynecologist or OBGYN. And if you're high risk, make sure you're really getting in there and getting screening done ahead of time.
All right. And if you want to find more information, you can go to necancer.org/breast cancer. That was Erin Dorn, an internal medicine physician assistant with Beatrice Community Hospital. And I'm Ellen Simmons for the Rural Radio Network.